This episode is on the NDIS audit process in times of COVID-19. My name is Steve Waite, a Business Connect advisor and CEO of the Business Centre. The broadcast today is marked on us as humans. Perhaps it even causes stress or it affects us change or disorder in our lives. But how does this then impact on the process of the NDIS audit? How has the pandemic affected the audit process for small providers and small business? Well, joining us today to help us with this topic are two special guests. One, an NDIS auditor, thank you Chris, and one, a small business owner in the sector who has recently been through the audit process. Both of them are going to reflect and share on their insights and experiences with us and develop a practical understanding of the processes. To our first guest, Chris Hext from SIA Global. Chris is the Technical Manager, Health, Disability and Human Services for SIA Global and is the SIA Global NDIS scheme owner. Chris has in-depth expertise of the NDIS practice standards, including all of the audit processes and requirements. Chris has significant experience in managing accreditation requirements for health, disability, human service standards, including NDIS, NSQHS, HSQF, Human Services Victoria Standards in Victoria, and the National Standards for Disability Services and the Quality Assurance Framework. In his role, Chris works with a broad range of stakeholders and regulatory bodies, such as the NDIS Commission and JASANTS. We thank Chris for his time today. Our second guest is Brad Child, Founder and Clinical Director of Activated Concepts. Brad Child is the Clinical Director of Activated Concepts Consulting and Counselling, established in 2020, which has recently gone through a verification audit. Brad, prior to owning his own business, held management and senior clinical roles across the health sectors, including the Department of Community Services, and Brad managed a federal health mental health program and was a coordinator of a registered training organisation. Brad is accredited with the Australian Association of Social Workers, and we're extremely pleased to have Brad with us here today. Now I want to set this up a little for us so that we get a sense of the conversation as we move forward, and then we can begin with the questions, which we've got about 5 or 6 questions we'd like to work through. So let's just set the scene and create some context that we're all aware of by sharing the evolution of the audit process as we understand it since the NDIS came into play. So the NDIS launched a trial phase in July 2016, and in its rollout has been now completed. The NDIS audit process was introduced in more recent years and standards were set. These were the NDIS practice standards, a set of policies that all providers must implement in their operations and are now in practice. And these are the standards that lay the foundations for the NDIS audit process. So everything basically revolves around the terms set out in the quality safeguards by the Commission. So the audit was born and independent auditors were chosen by the NDIA to review each process for providers and their policies so that they met the standards and the code of conduct. Now initially I think we would all accept that there was a lot of robust conversation around this process, but the long and short of it is that processes are important to business and particularly important when vulnerable people are concerned as customers. There are 2 types of audits, as we know. I'll get Chris can correct me here if I'm wrong with the definitions, but verification and certifications. The verification audit is required for sole proprietors or small organisations delivering low-risk supports to participants. These audits must be performed every 3 years, and the audit is a desktop process. The certification audit is more full-on, takes up more time and is made up of 2 main steps: documents reviewed and then an on-site audit process. So that brings us to our webcast today and a conversation around audits in the time of audit of COVID-19. Noting, as I understand and have read, the NDIS has provided advice to registered providers and auditors, which has recognised some relief and adjustment to the audit practice to recognise for participants and providers and auditors that there are particular options available in terms of varying or extending the audit process or the registration process with human safety front and first of mind. So, long introduction, but let's get started. I thought it was important that we do set that up. Now, all of us have got notes, including myself and Chris and Brad, to help us make sure that we work our way through this. And I think it's probably important from the outset that December 3 is International Day of disabled persons, and it's a celebration of that, and I think it would be great that we acknowledge that. So the questions are kind of bounced around there. They're about, I think we just want to set the scene. How are we all dealing with this thing? How's it all working? Then we're going to look at the type of audit and differences in the audit process. Then we're going to look at audit in the time of COVID in 3 parts. We'll then look at some shared experiences, some learnings that we share with each other to conclude. But first of all, and I'll go to you first, Chris, before we go to Brad, how has this whole thing been for you, this pandemic? What's it meant for you?
Yeah, well, yeah, like everybody, it's been a hell of a ride, I think. I was actually on holiday at the time that all the lockdowns kicked in, at the start of a extended overseas trip. Had to fly back, go into self-isolation to find all the offices abandoned. So that was interesting. But yeah, as a business, I think SAI have actually responded exceptionally well under the circumstances. I think we've been pretty agile, adjusting to the new normal, as everyone's referred to it. We are already accredited by JASANTS to conduct audits remotely. So we actually already had a framework in place to be able to do that. Now that framework wasn't designed, of course, for doing 100% of audits 100% remotely. It was more designed, perhaps out of a 5-day audit, you might do a half a day or a day remotely if there's a location that's a bit more difficult to get to and there's a reasonable justification for it. But as you mentioned, the NDIS Commission and a lot of the other regulatory bodies for the other schemes and standards that we audit to, they loosened the reins, I guess you could say, and gave their blessing for audits to be done 100% remotely. Now we still had to re-engineer our processes and procedures to make sure that they worked under the new circumstances, worked for us and worked for the organisations that we were auditing. And we still sort of go through a process where we review the suitability to do a remote audit, and there still might be circumstances where we will still need to do an on-site audit, but by and large, particularly for disability and human services, we've managed to do the large majority of them remotely. It's no small effort from our operations team, our schedulers and our auditors.
I was about to say, just for the human impact on you as an organisation.
It was an enormous effort. Like I say, I felt very bad because I was on holiday and then I was in self-isolation, so I couldn't sort of help as much as I wanted. But yeah, particularly our schedulers and our auditors, huge effort from them to reschedule all the calendars, adjust to the new processes and requirements, work with our clients, and we actually had a pretty stunning turnaround. A sort of unexpected number of clients were more than willing to reschedule their audits rather than completely push out for several months and say, no, it's not going to happen. A huge amount of clients actually were very willing to go forward with their audits, which we were initially quite surprised about, but it actually made sense. I mean, for a start, from the provider's perspective, audits were going to be cheaper off the bat, no travel costs. If particularly if they're in a sort of more remote location.
That would have been welcomed by a lot of providers.
Absolutely. And a desire to maintain some sense of normality, I guess, and business as usual, wherever possible. Those that already had certifications in place probably didn't want to place their certifications at risk if they had deadlines, if their certification was expiring. And also the idea of using the audit process to actually determine the effectiveness of their systems in dealing with this crisis.
Indeed, I didn't think about that. So
and particularly where it comes to vulnerable persons, people with disability.
So it's actually helping them test their systems about service delivery as well as being compliant.
I think there was a strong understanding that for if they could reasonably do it, let's do it.
I might turn to you, Brad. How were things for you, when this hit, given that you would have only recently, or you were going through the process, what did it feel like? What was it like?
It was a very intense sort of process, I think, for us. I think COVID in particular placed a lot of restrictions and fear in the community and on business. So what I experienced outside of the NDIS was a slowing of referrals. Had to complete, a mind map of risk assessments around temperature checks,
yes.
asking people where they've travelled, who they've been in contact with,
yep.
Looking for notices, putting that out there, particularly in a clinical space with interview rooms.
Yes.
How do we ensure social distancing?
Yeah.
Looking at face masks, those sorts of things to try and alleviate some of that anxiety for the general public and for patients that we were seeing. Obviously, that then, as the restrictions started to get tightened, we obviously made the move, like many others, to telehealth.
Yes.
And looking at offering services in a different way, which raised its own complexities for a lot of patients. Some that just did not want to be on telehealth, but as an organisation as well, looking at confidentiality and how do we maintain that.
I was going to ask that.
Systems.
Yeah, how did that? Yeah. Given that added layer, I guess, in terms of confidentiality and patient care and participant care, did some of the assumptions you'd made about that in regards to being compliant to the practice standards, did that add another layer in for you? Definitely. And obviously that was one of the first questions we wanted to address before having to be asked of anyone working with us is how are we ensuring their safety? So luckily having working for health as well, doing work in the mental health unit here in Newcastle, we use Scopia. And we know that that's encrypted and guaranteed to be safe. So we very much adopted the same. But I have since learnt that Skype is soon to be endorsed. And Zoom is also in that process, I believe. So they were the main, in relation specifically to the NDIS. I think the biggest impact that I've experienced, and Chris, I'm sure is probably well aware of this as well, is a massive delay with the safeguards, the Quality and Safeguard Commission. They have been absolutely inundated. So I'm seeking, so I've been passed for my audit and everything else, but I, like many other providers out there, waiting for accreditation or that formal registration, and are in a massive backlog, and they cannot tell me when that will be remotely be addressed because of their significant, overwhelming. So how is that
numbers.
affecting you as in your operation of your business in this?
It's pretty significant. It's pretty significant because we were told it would be a lot faster than it was. So we planned around that with our business, with our marketing. But ultimately, as a registered provider, we can still offer services without being registered unless they're directly through the NDIS portal. So we're still getting referrals in that space. It's just adapting to, I guess, having to work that out.
Thank you. Okay, let's get to this question. This one's directed for you, Chris. So at the start of 2020, the Commission made changes to the rules about which businesses need to undertake a verification audit and which needed to take a certification audit. Can you just step us through that, if that's okay, please?
Yeah, absolutely. Yeah, so for the first 18 months or so of the scheme, after it rolled out, there were essentially two components that qualified you for a verification audit. So were you a sole trader or a partnership, and are you delivering only low-risk registration groups? Now, low-risk registration groups, that would be things like personal mobility equipment, home modifications, therapeutic supports, household tasks, personal training, things like that. If you were a body corporate entity, so a PTY Limited, then regardless of what registration groups you delivered, you still had to go through a certification audit. Now, understandably, that wasn't the most popular decision. And so after a lot of consultation, after those sort of 18 months, the Commission decided to change those rules and ease them and particularly that would benefit the body corporates to essentially allow any organisation, regardless of their entity type, their business structure, to deliver, to undergo a verification audit, to be eligible for a verification audit, as long as they're only delivering those low registrations, low risk supports.
Okay, that's great. Well, that was a good response to what was a concern out there, isn't it? And has there been any complication of that as a result of COVID, or is it just flowing through?
No, it's flowing through. It's made the process a lot more straightforward.
Yeah.
I think, particularly for providers, but likewise for ourselves. Before the change, we were sort of having to explain the requirements to providers when they would call up and ask for a quote for certification. And we would sort of have to talk them through why they're not perhaps eligible for a verification audit. Whereas now it's very straightforward. It's purely down to what services they deliver, which is a good change, I think.
Brad, did you find navigating that? Because I remember in the early times that we at the Business Centre here were helping people, that was a little bit tricky. Did you find the process of self-assessment and finding where you landed clear for you?
Not at all. So that was probably one of my biggest learnings going through this NDIS process, because I think like many providers, from the advice I'd got back, I ticked everything in the way of like, I want to offer this down the track, or I'm going to do this down the track, so I might as well do it all now. So that was a big learning for me. One that I was very...
Yeah, that's been the challenge for a lot of providers, I think, is deciding what to go for now and what to push down the track perhaps a little bit if it's not something they're currently delivering, but they think they want to deliver it. There are benefits to doing it up front now and being prepared for it and not having to do perhaps another audit later to add it. Or perhaps, let's focus on what we're currently delivering and get registered for that.
That's a fair reflection, isn't it? I think if people need to understand, if they make a significant change to their profile, they are probably going to trigger, or they will trigger.
Potentially. It depends whether it triggers another module, which we'll get to later. It depends on what's required as part of that particular registration group.
Okay, Brad, back to you for a more specific question. We're going to jump into the audit process itself now and just get a reflection of grounded experiences there. So, you've completed your first verification audit. I want you to try and draw on some of your experiences and what were the practice standards that you were assessed against in the scope, and what kinds of documentations and systems did you need to create in order to meet those standards? And please, both of you, feel free to contextualise that around this pandemic environment and what you may have had to do since that. But if you could just perhaps jump in on that for us, Brad, and share with listeners.
Sure, Steve. Definitely the experience for me was quite, it was a lot to take in. There was a lot of research, and I think I underestimated that quite heavily in the start. I thought I knew quite a fair bit about NDIS. However, the more I read, the more research I did, the more consultations I had. I learned a lot more about, I guess, exactly what we were just talking about, the benefits of registration as opposed to businesses that don't get registered and what that avoids them from with the NDIA. The cost difference between a verification and a certification, the difference in even NDIS auditors in the way in which they do things. And also, and again, as we touched on a little bit before, the understanding of the registration groups. Being an accredited social worker and as a health professional, allied health professional, we are deemed low risk because we do have our own set of practice standards. We do have our own code of conduct. We must adhere to those, and the NDIS then sees that as a level of accountability and lowers that risk, even though we are offering therapeutic supports. The practice standards that I guess was assessed against was the core module. So for me, that was looking at rights and responsibilities for participants, governance and operational management, the provision of supports, and also the documentation and systems that I really had to put in way of that was literally everything for me. So the beauty of it for me, in my experience, was that, and the reason I chose to do this was that it actually forced me to sit in a space of going, I need to create every document and be 100% above board before I even start up. So prior, and I think from learning from other practitioners and other providers out there, everyone sort of operated on the run and created documents and policies and procedures as they need. So this process, going through the NDIS audit for me, meant I developed a HR register, compliance calendars, looked at risk management policies and procedures, incident management policies and procedures, service agreements, control document registers, you name it. I've kind of got that now. for my business,
So,
which
Brad,
was a major learning.
Sorry, do you think, given that you'd been through this process, when, and I'm sure you did, you had to introduce some heightened or strengthened or new policies and procedures as a result of COVID, for example, infection control, did it mean that because you had some order around what you had in place that it was easier to introduce those?
It was a little bit easier, but it definitely took a lot more consideration. So part of the core modules is providing a supportive and safe environment.
Yeah.
So that's something the auditors do look for.
Yep.
So I had to have a management strategy in relation to home visiting, to community visiting, and look at how I was going to operate in that light.
Yeah.
Yeah, and from an auditor's perspective, that there's, of course, we got the NDIS practice standards, which is what we're auditing these providers against. But there's all sorts of other regulation and standards that providers must also, depending on what they deliver, that they have to comply with those requirements as well. And it's their responsibility to know and understand those requirements. Now, the auditors themselves will know, obviously, quite a bit. That they won't know everything. No. And it really is the provider's responsibility. So when something, COVID came in, and obviously it's the same for everybody to an extent that this has never happened before. So it's not like anybody had any existing procedures in place. So it was certainly a challenge for, I'd imagine, for providers to
Can we dwell there just for a little? Because on reading for this, I do note that there was notifications and advice coming from the Commission around infection control. Specifically, what did that actually mean? Perhaps to you first, Brad, and then to Chris from an auditor perspective. What did that actually mean? What did you have to do to meet that benchmark, if you like, or that requirement?
Yeah. So for me, it was very much around social distancing, keeping a record of who's coming in and out of my business and their details, keeping accurate time records. So if someone was COVID affected in my business on a particular day between, say, 11 and 12, we know when that is to help trackers. And obviously then we had to do temperature checks. That was encouraged, looking at face masks, all those sorts of things. Obviously hand sanitisation was huge. We always had to have a bottle out at front for people to sanitise their hands on entry and as needed. Okay.
For you as an auditor, you are looking for industry standard practices. So what does it mean?
Yeah, I mean, as I said, it was the sort of thing where we expect the provider to know what they need to do, and we need to see. They need to be able to demonstrate that they're doing
evidence of that.
Evidence of that. So look, there's nothing in the practice standards about making sure social distancing and hand sanitizer and all of that. But we do expect to see things like the support provision environment, making sure it's a safe, clean environment, and specifically how are they addressing these particular requirements. So it's a good example actually. We underwent our Jazz Ants audit a couple of weeks ago. So they were looking through our audit reports, and they specifically were going through them to see if the auditor had referenced anything to do with the client's COVID safe plan and what they were doing about COVID. And it was in the report. Thankfully, the auditor had documented it. So we're just looking for evidence that they have implemented some sort of COVID safe.
Good advice for anyone going through the process. Don't assume, and obviously is something that needs to be addressed. You can't just leave it as, I've put my policies and procedure framework in place. I don't need to address it. It's assumed, not assumed. Don't assume.
No, it has to be demonstrated.
Okay, question back to you, Chris. So where verification audits have always been conducted remotely, certification audits are supposed to have a stage 2 component that were conducted in person. So when COVID came along, it really disrupted the way certification audits, have occurred during this. So could you share a little bit for us and for our listeners about that? What does it look like?
Yeah, so it was definitely a big change for us. As you say, that they were ordinarily done on site or in person. We did do the occasional one where we could justify doing it remotely. But as mentioned earlier, we were able to pivot fairly swiftly to doing these remote audits. Huge adjustment for our auditors. These guys are used to going out traveling on the road every day. One of my auditors told me that he doesn't think he's ever sat in the same chair for a lot more than 3 days at a time. So I think it was quite a mental adjustment for the auditors. We've had to train all our auditors in remote audit etiquette.
Tell me more about that.
So yeah, it's even little things. I mean, it's the typical things you see about how to conduct yourself over a Zoom meeting, I guess. It's just that the Zoom meeting is going on potentially for 3 or 4 straight days. So it's about maintaining the professionalism. Social interactions can be a lot more challenging. If you're not in the same room as that person, it can be very challenging. You're not in the room to pick up on social cues. It's important not to interrupt anyone, of course, not talk over them. Warning the provider if they're screen sharing and they're showing you some evidence, and then they flick to their emails, and we can see their emails. It's important for the auditor to immediately tell the provider, well, by the way, I can see your emails. You might want
notifications coming through or something.
You might just want to hide your screen.
Turn those off.
So just important to point those out to the provider. So it's little things like that you might not necessarily think about, because I mean a lot of Zoom calls you're sort of with your colleagues, I guess, but when you're doing it with providers that you're auditing, it's different. Making sure there's nothing in the background, making sure that you're well presented, all of those kinds of things.
Can I ask a question from an auditor perspective? So you would have had documents submitted to you anyway. If new documentation is provided as is inherent just in the actual audit process that you're involved in online, are you screen capturing, or are you videoing this?
So I guess what we're getting at is the confidentiality aspect and the privacy aspect of the documentation, which is tricky. Now, we recommend to our clients, where possible, screen share, so they maintain control. We certainly don't record the audits, and we don't take screen grabs. But yeah, we do try and stress that we want the provider to maintain that control of their documentation. I do know that it can be challenging, particularly where there's where the provider needs to provide perhaps a driver's license for a worker, or some sort of worker screening evidence, and they have to hold the driving license up to the webcam, which is a bit difficult for the auditor to squint and see the details on that and note them down. But that might be what they have to do. Sometimes it's inevitable that the provider will just have to email stuff through, in which case the auditor will absolutely delete that at the end of the day, or if they've got a system like SharePoint where all the documents can be uploaded to there and deleted afterwards. Or the provider might have already uploaded a lot of the documentation into the portal already, so it's in there. But yes, it's absolutely vital to reiterate that the auditors do not retain any of the evidence that's provided to them.
I just want to, Brad, from your colleagues in your profession, in your industry, have you heard any feedback or anything you'd like to add about the audit experience online?
No, I think, well, the only thing that has been consistently fed back to me is how consistently inconsistent it can be, depending on which auditor you get, and which agency you're going through. So I know people that have gone through audits and had very little to no contact, other than a confirmation email at the end saying, no worries, you got through, well done. And others that have been a lot more involved. And that's on both sides of certification and verification. Obviously, certification requires the audit, a much more intense audit anyway, but the level of engagement can vary a lot, and expectations as well.
Chris, that having had a past life in auditing and compliance, that can sometimes be very much a contextual thing about the style of the auditor. It doesn't mean that they're straying from the standards or misinterpreting it. It's just a stylistic thing sometimes. So if we're talking about different auditors taking different approaches, absolutely.
auditors don't come off a,
conveyor belt.
Come off a conveyor belt out of a factory, so they do have their own personalities, their own experience, their own knowledge. You might have an auditor with a background in health and safety, so that's something that they might pick up something in an audit that an auditor who's a background in something else wouldn't necessarily pick up. And it's just unavoidable. That they are all auditing the same standards, so ultimately there should be a air of consistency, but there will at the same time be differences. And we have had to sort of have conversations about that with providers. And
there's a code of practice.
You've got to see that as a benefit. At the end of the day, yes, one auditor might not have picked something up at one audit, and then at your next audit, a different auditor might pick something else up that wasn't picked up before. Even if nothing has changed, that might well happen, and that's purely because of the experience of the auditor.
And there's a code of practice for auditors, and I'm sure you, as every other auditing organisation approved, have a very transparent and open way of having a conversation about the audit and the audit experience.
Absolutely,
as part of the process.
We have to, because people have to trust the process. And look, we're certainly not perfect. And if there is an issue, absolutely the client can come to us, it can approach us and explain the issue, and we can try and work it out.
Now we take some live questions, so I've got a question just come through to you, if you're happy to take the question. And as we spoke about, if there's some things that we need to do a bit of research or we need to take offline, we'll certainly answer them offline later. But the question is from Janelle Rhodes. She's asked, how long have you heard the Commission is currently taking to process successful audited businesses? We touched on it a bit, but... Yeah,
so it's actually a question where we can't really answer. The Commission hasn't actually given us a time frame for how long they're taking. We don't have any transparency on that process. Literally, once we submit the report and the recommendation to the Commission, it's all over to them. We can't provide any kind of timelines because it varies so much. I'm not sure how they're prioritising the workload. I think it's a combination of registration end dates and when the application was originally lodged as well. I think they're sort of taking into account both of those dates. Okay,
Brad, you said something about that earlier. What are you hearing other than it seems to be backlogged?
Yeah, well, I spoke to them literally last week, and I was told it's a bit of a perfect storm at the moment for them. So NDIS boomed in 2017, so they got a lot of 3-year audits coming back through.
Of course.
For recertification and re-auditing. And then because of the COVID pandemic, effectively there's a lot of people out of work, or a lot of people that have dipped into the NDIS space and thought this is a way for me to make an income, and are, effectively seeking to open up businesses. So they've received a bulk amount of new applications they hadn't predicted as well. So their advice back to me is that they concretely cannot give timeframes at this time. They won't even sort of indicate any sort of rough estimate at this time.
We're in the same boat as the providers on that, unfortunately.
I mean, it is extraordinary circumstances, so I think we all understand that. Chris, when do you think there could be a return? Are you planning on that? Have you got a runway, a horizon to in-person?
It's so difficult to say, honestly, because no one knows when the vaccine's going to come. No one knows when restrictions are going to ease. I think as a business, we're taking a fairly long view of it, because we don't want to be going back to planning on-site audits and then having to completely rework everything at the last minute because there's a last-minute lockdown. Where we can avoid that, we'd prefer to avoid that. So I think we're taking the view that for the time being, we're still going to proceed with remote audits. Of course, where things do look particularly good, we will potentially seek to start doing some on-site audits again. But it's very difficult to say right now.
I guess you guys are a business as is Brad, so you must probably always be planning for example, the outbreak that we had in South Australia, where things can very quickly change. So even if you have returned to normal, inverted commas, you could very quickly always have to go back to an online and physically distance.
Absolutely, because if we schedule an audit in South Australia and we have to use a New South Wales auditor perhaps because of a particular skill set, and while they're over there, if there's a sudden, if there's an outbreak and we have to call off the audit halfway through, or something like that, it's a lot of disruption and rework to have to deal with.
So say we have a small business owner has been through the process, they've registered, they've then identified an auditor to work with, you've had that initial communication. When you are sending out your scoping documentation, are you having a paragraph or some information about the way that you're going to audit? Do you describe it, or do you make provision for that? Do you explain that it's different? In
terms of it being a remote audit?
Yes. Yes.
Not at the stage of like signing the agreement. No. Our application process is pretty much unchanged. Of course, our business development staff would have that conversation, I'm sure, with the organisations about the potential for remote auditing. But that conversation is held just a little bit later when our scheduling team actually make contact with the organisations. Yeah. So we have a special form called a remote audit questionnaire that we send out to providers when we're offering them dates, and we ask them to complete that questionnaire, and that just helps us to make a determination on whether they're suitable for a remote audit. And by and large, they are. It's simple questions like, do you have has your business been affected by COVID-19, which for pretty much everybody is yes in some manner. Some people have actually answered no to that question, and we've actually talked to them and sort of gone, think about it from another angle. You probably have been affected in some way. Do you have a COVID safe plan in place? Do you have the right tools to be able to, can you set up a Zoom meeting? Can you accept a Zoom meeting? Things like that. Because there are some organisations that actually can't do that. We might have a construction company that don't really have adequate means to do an audit over Zoom or something like that if they're on a construction site. But certainly for the NDIS, it hasn't been too much of a challenge. I guess just a question for you again, Chris. What are the most common registration groups you're encountering in the last 12 months, and how are they coping? Yeah, it's we don't actually report down to that level in our systems. But I did have a look, and I would say that we probably have about 60% of our client base is around 60% is on certification audits. So that would be they have at least one medium or high risk registration group. A common low risk one that I see a lot is 0128 therapeutic supports. That's quite a common registration group. There's a lot of occupational therapists out there doing their thing, and who are now required to register with the NDIS Commission, undergo the audits. Low-risk registration groups are always very common. You've got a lot of holistic providers that provide all sorts of different services. Their bread and butter might be the medium to high-risk stuff, but then they sort of have the lower-risk ones on the side as well. So generally, from what I've seen, and this is purely sort of anecdotal, but if you get a low-risk provider, so someone undergoing the verification audits, they're far more likely to only perhaps deliver one or two registration groups. Whereas if you have someone who's on certification audits, they're far more likely to have, in my experience, a number of registration groups, spanning the spectrum, so low, medium, and high.
Excellent. Okay, anything to add there, Brad, to that part of the conversation?
No,
don't have to. Just thought I'd give you an opportunity. Okay, so we're looking now at, I guess, learnings and tips, or what advice would you give to people as they prepare, and even when we're out of the pandemic, and what would you wish, Brad, that you'd known before the audit that you didn't know? You want to have a go at that and share some learnings, some maybe some pain?
Sure. I think for me, that I went into the NDIS world having known a lot of it from a clinical setting within health and within communities and justice, working alongside it, thinking I understood NDIS quite well from all different ages. However, coming in as a business owner, I realised very quickly that I did not know much about the specific elements within the NDIS and the practice standards and the expectations of the Quality and Safeguard Commission, and that they outsource their auditing to the to NDIS auditors such as Chris, and really getting into the finer detail then of drilling down into what do I actually need to be registered for? Because as I said earlier, I went in and went, oh, okay, well, I want to do community participation.
Yes.
Oh, okay, I want to do behaviour support plans. Okay, I want to do therapeutic supports. And then, so for me, what I wish I'd known when I did my initial online application is a lot more about those particular registration groups and being a lot more clear. And that's where the business centre in Newcastle came in quite handy. Connecting with a business advisor, I connected with Nat Ellis, and she was brilliant at really understanding and really critically analysing my business model and looking at me and saying, okay, but you're saying 90% of your business is going to be in this space, and this is the difference, because I didn't understand the difference at the time between a verification and a certification. And for a startup business, what I, particular, that was a big dollar difference. You're looking at a $5,000 potential of a certification as opposed to around $900 I paid.
That's significant.
For my, so that's a huge difference in upfront cost for a startup business.
Indeed. Okay. So what about you, Chris, as an auditor, and as leading auditors, you must see so many pitfalls, traps, things that people just don't see. And as we were talking earlier, auditors are very familiar with systems language and policy language. So what tips or what advice or learnings would you share? I
mean, sort of tying in with what Brad was saying, preparation is absolutely vital to the audit. It's not an easy process, particularly if you haven't gone through this kind of thing before. It can be quite overwhelming, I think, for a lot of providers. And as we were discussing earlier, it's really been an education for a lot of providers. It's been an education for us as well. So sort of having to work with a lot of people who are completely new to the idea of auditing. I do sort of have to preface this as well by saying that as a certification body, we're not allowed, we're actually obligated to remain impartial.
Of course.
So we cannot provide specific guidance to anybody on how to pass an audit, how to resolve non-conformances, things like that. That's what a consultant would be for. So I just want to sort of preface that.
Understood.
But I do have a few tips. So make sure you read the NDIS practice standards. It's the really big pitfall that a lot of people don't actually realise.
Brad's nodding his head.
With any standard, make sure you read the standard and really make sure you try and understand it as well.
And it is set out quite well. It is the language, the structure of it, it's quite accessible.
And make sure you understand it. So even if you've got a consultant assisting you and working with you and helping you, when you actually come to your audit, the auditor will expect that you as the business owner or the manager or whatever, to actually understand the idea of the NDIS practice standards and what it's all about. You don't necessarily need to understand every single little minute detail, but there does have to be a fundamental understanding there of what it's about and why you need it.
And what it means for you and what your registration is. It's about 97 pages, it's not short.
I would recommend completing a self-assessment or conducting some sort of internal audit before you start. An internal audit is a sort of expectation of this kind of thing.
Well, we might have to close off. We'll leave it to there. Our alarm's gone off. So we'll thank everybody and we'll close our webcast there. Thank you very much.
Thanks, everyone.
Thanks, Brad. Thanks, Chris.
Thank you.